Did you know that 80% of pregnancy-related deaths in the United States are preventable? Did you know that? And did you know that Black women are 3 times more likely to die from pregnancy-related causes than white women? And there are multiple factors that contribute to these disparities. The quality of healthcare, underlying health issues, access to prenatal care. Social determinants of health prevent many women from getting the healthcare access that they need, like fair opportunities for economic, physical, and emotional health. As you can see here, this is on the CDC's website, CDC Women's Health. The morbidity for Black pregnant women and their babies during delivery is significantly higher due to various factors, including systemic racism, socioeconomic inequalities, and implicit bias. Now, I'm going to show you a video here, and it's triggering. So I'm going to show you a woman in labor at a hospital, and then we're going to talk about this video. She's in the emergency room triage, which is where most women are told to go when they are in labor. And as a registered nurse, like, this really breaks my heart. As you can see here, Black women are more likely to experience life-threatening conditions such as preeclampsia, postpartum hemorrhage, and blood clots. These conditions not only pose immediate health risks, but also have a long-term consequence. So when a woman shows up in the ER, there's a reason why she's told to go to the emergency room. It's an emergency. You can't tell unless she's examined how far she's dilated. Is the baby ready to come out? What is going on? What is the baby's condition? There's no fetal heart rate monitor in triage, right? Like, you have to get her to labor and delivery and put all these things on. So let's watch this video and then we're going to talk about it. Here we go. This is a woman at Dallas Regional Medical Hospital in Mesquite, Texas, and her son was born 12 minutes after this video was made. Let's watch together.
Now. What?
How many times have you been pregnant?
Please.
This is your third pregnancy?
Yes.
You have 2 babies
It's
at
in
home?
my ass.
You have 2 babies at home? Who's your doctor?
Lang is her doctor. Y'all treat all your patients like this or just the Black ones?
There was a personality patient for you. Her name is Jones. She's G32. I'm not sure when her due date is.
Her due
I
date
just
is
said
the
it
10th.
was the 10th.
She got 3 pregnancies, 2 babies at home. I bet y'all listen next time. When you found out you was delivering at this hospital, your ass should have changed doctors.
Thank you.
Everybody say how they treat people here.
Now, as you can see, this woman is in labor. She literally said, I can't. This is the nurse. The nurse is not even paying attention. This is crazy to me. Completely insensitive. I don't even know what to say to this.
Yes.
Are you able to call the anesthesiologist?
Someone is going to take you to labor and delivery.
That's not what I asked.
I cannot, no. Thank you.
She's completely uninterested in what's happening right now. And she's the triage nurse in the emergency room.
Yes.
Are you able to call the anesthesiologist?
Someone is going to take you to labor and delivery.
That's not what I asked.
I cannot know. Thank you.
This breaks my heart. This breaks my heart. I want to read some of the comments here. What's this lady's name? Continue to flood their Google page reviews. LaChrista Vaughn is the nurse. LaChrista Vaughn, they put her license number. I cannot help, ma'am. We take an oath when we graduate nursing. Oh, I can't even speak. This is so sad. You know, this reminds me of when I was in labor with my first child, and as a Black mom with 2 Black babies, this is heartbreaking. I don't think you realize the difference in the care that you get until you have been there. And I remember being in labor and delivery, and they gave me Pitocin. And if you don't know what Pitocin is, that's what they do to induce the labor pains that will cause you to dilate, because I was only like 1 or 2 centimeters dilated and I wasn't having contractions. So usually they give you Pitocin, you have contractions, and then you dilate. 14 hours later, 15 hours later, I had not dilated. I think I went from 2 to 3 centimeters in like 15 hours. And if you ever had Pitocin, the labor pains, they're harder and they're more frequent than your natural labor pains. Here's the kicker. The nurse came to me and she said, "Ma'am, your Pitocin's about to run out. The drip is about to run out. And the doctor has ordered us to put up another one. You can refuse the Pitocin." And I didn't know that. I was like a new mom getting ready to have a baby. Of course, we all want to have natural births. And I'm digressing here a little bit, but when you have a nurse that's on your side that gives you the best advice, I was in so much pain on all fours on my bed like this woman is. And I was just like, am I ever going to dilate? When am I going to have this baby? And the longer you stay in labor, the more risks there are for morbidity and mortality for both mom and baby. So with that said, you have a person that comes into the emergency room and this is the treatment. They're in labor. They should have put her in a chair and rolled her up to labor and delivery. Call the doctor. They could have called the doctor. I don't know if she's with her mom in the emergency room, and her mom said that they had told her not to change doctors so that she wouldn't have to go to this particular hospital. But should that have to be the case? If this is the nearest hospital to her, shouldn't the care be the same? And I talk a lot about nurses being abused. Patients are also abused, and there's such a disparity, and there's such a higher rate of death for Black moms that are pregnant than there are for white moms that are pregnant, that this is unacceptable. So drop a comment, let me know what you think. Hit that like button, subscribe, hit that notification bell. I think this woman should lose her nursing license. This is not the care she signed up to give. This is not the care that this hospital signed up to give. The nurse is in triage and she's not by herself. Where is everybody? Where are all the other nurses who could have stepped in and done something and said, hey, it's an emergency right now? I'd be scared to go to the hospital as a Black woman, to this hospital, if I was having a heart attack. Because what? They're just going to let me sitting there? They're not doing anything. Where's the ER doctor to check this woman? How far dilated? She looks like she might, I don't know, because we can't tell, right? But she looks like she might be like 10 centimeters dilated, ready to push this baby out. Right there, in that chair. Insane. Unacceptable. I will link this in the description box. There are plenty of comments here. Someone says suing the hospital isn't enough. You need to contact the nursing board. Of course. Oh, make her famous. Yeah, this is the nurse. Someone says make her famous. This is such a shame. That's such a shame. Who does that? Who does that? I can't imagine bringing a mom into the emergency room, a mom coming in and being in so much pain, no matter what nationality she is, and not being compassionate, not showing care. And I know as nurses, we have to stay calm, right? But this is beyond, this is not calm. This is apathy. Like there's no empathy, there's no urgency, there's nothing. And there's nothing. This woman is just flat. Maybe she's burnt out. If she's burnt out, then she should not be working triage in the emergency room. Get another job. Get another job. This is not for you anymore. If you've reached this point where you have complete apathy for someone coming in this situation where you know that it could go bad really quick, then no, this is not for you. I understand that nurses burn out. When you're burnt out, you need to admit it. Get some mental health care and go do something else, or you're gonna get sued. So hopefully she has nursing insurance. There are some other videos here. Once I'll link this for you, you can go see what the outcome was. But they said she had the baby 12 minutes later and the delivery was horrible. So go figure. Because here's the other thing. They had no time. Oh, I can't stop talking. Because if she had a natural delivery 12 minutes later, that baby probably tore her up. Tore her up. Because there was no preparation. No care, probably no time to even give her any type of epidural so that she didn't feel the pain. So basically, this nurse put this woman in a position where she put the baby and the mom at risk. Or this hospital did. This hospital and this nurse. I don't know. Unbothered. Being unbothered can be not a bad thing. This is definitely not a place to be unbothered. And if you are this unbothered as a nurse, if you're watching this and you're a nurse and you're in situations and you see yourself in this video, if you see yourself in this woman, find something else to do. This is not it anymore. All right. I love you guys. Drop a comment. Let me know what you think, and I will see you in the next one. Thank you for joining me on The Broken Shift. Whew. All right. Bye.